the talk. Right. One of our talks in our medical halacha series for the Jewish medical professionals of Pittsburgh. And today we also have the Jewish Physicians Network also tuning in from New York and many other areas. It's a great honor to have Rabbi Langer here, who's just his wealth of knowledge. I can begin to explain. Today we're going to be talking about cosmetic surgeries. This will not be the only medical halacha. This is not the first, and certainly not the last. We hope to continue to grow onward and upward in terms of the medical halacha shiurim and other aspects of our group as well. So welcome.
Yeah, he's sticking around if like you interject with more correction. Okay, we'll give it a shot. Okay, thank you for all those who I made it and everyone who was involved in preparing this event. And we'll go. Let me just. I was told by Rabbi Miller once. For those of you who remember Rabbi Miller, I was told how you're supposed to give a speech, and I promptly have all the years now. I have been totally ignoring all the instructions he gave me. But maybe tonight, a special occasion, will follow Rabbi Miller's methodology of how you're supposed to give a speech, which is you're supposed to tell people what you will be saying, then you say it, and then you tell them what you have said. And I've been totally ignoring all this for 20 years now, but maybe tonight we'll do something along those lines. So let's talk about what we will be doing. I probably will forget at the end to say what I did say, but we'll start by saying what we want to say. First, we'll go through just a couple of basics of a few Jewish sources about the idea of ensuring the dignity of one's appearance and the appropriateness of one's appearance. How we find Talmudic Midrashic sources for that. We'll just go through some of that. We'll go through some scenarios of cosmetic surgery that come up and have some halacha questions. A lot of them are connected with others. We won't go through every case, but just a few of the cases, and then we'll mention some of the basic halachic issues that come up, and then we'll go through the halachic discussion. So that's some of we try to go follow that plan. So just a few thoughts on the concept of making sure one's appearance is appropriate and dignified. So you have a Medrash, Yalkut Shimoni. The Medrash says that Hillel Hazokain was a fulfillment of the verse in Mishlei, Gomel Nafsho Ish Chosed, the person who's a person of kindness, Ish Chosed, provides for his own nefesh, for his own spirit. That is interesting. In other ways, one does kindness for oneself. We speak of and we think of doing kindness for others, but according to the Medrash, based on the pasuk, we have the idea of also doing kindness and acting appropriately to oneself. So the Medrash says that the embodiment of that was Hillel Hazokain, Hillel the elder. That says one day he was walking with his disciples, and the disciples said to him, Rebbe, where are you going? They said to him. So he said, I'm going to do a mitzvah. And they said, well, which mitzvah are you going to do? So he said, I'm going to bathe in the bathhouse. So they said to him, okay, is that a mitzvah to bathe in the bathhouse? No, of course, in those days, it was a bit of an effort. You didn't have, like in your home, you didn't have showers and bath. You had to go to the bathhouse. So he was going to the bathhouse. What mitzvah is that? So Hillel responded, well, don't you imagine, he says, the statue of the king. You have the king has statues, the emperor has got statues, and then you have personnel who are in charge of making sure that the appearance of the statue of the king is attractive and appropriate and dignified. You don't want the statue of the king to look disheveled. So that's the cover, the respect you show for the king is by having that his image is also always visible in a dignified manner. So Hillel said that we human beings, the pasuk says, "B'tselem Elokim asa es ha'adam." So that means in the image of God, Adam was created, and we all are reflections of God's image. So therefore, since we are reflections of Hashem's image, it is a mitzvah to make sure that our appearance is always dignified and appropriate. So that's a source about Hillel, an important source. We have the notion of seeing to one's appearance. Another important source in the Talmud, actually, the Shabbos, the Gemara says that Rochetz Adam Panav Yadav V'Raglov B'chol Yom. A person should wash one's face, hands, and feet every day. So many times this is in a number of places in the Talmud you have this idea of the face, hands, and feet. Obviously, water was in much shorter supply in those days than it is today, and hygiene also was not exactly obviously up to what it is today either. So with one thing and another, the Gemara is actually quite into hygiene, and we speak about each day. Panav Yoda Raglav, one's face, hands, and feet, to bathe them. B'shvil kono, because of the honor of our Creator. That's what the Gemara says. It's to the honor of our Creator we wash our face, hands, and feet every day. And the Gemara brings out a slightly different idea than the Medrash. Kol po'al Hashem l'ma'anehu. That's the pasuk, another pasuk in Mishlei. Hashem created everything for His sake, to bring out His glory, to bring out His honor. So therefore, our appearance should bring out Hashem's honor. He's our Creator. We are His, so to speak, representatives here in the world to do His will, and therefore we should always have a proper and appropriate appearance. So the Gemara brings out this idea. This is the Meiri, which is an important medieval commentator on that Gemara, makes a couple of points. So the Meiri says something which is actually, it's going to come up later in some form a little later in our discussion. The Meiri says like this, that we always think of women being concerned with their appearance. And we don't think of men as being concerned with their appearance. Not only that, says the Meiri, there actually is an indicator in one of the mitzvos of the Torah that brings out the distinction men and women, because we have a pasuk, lo yilbash gever simlas isha, which in the simple sense of the pasuk means that a man shouldn't wear the garments of a woman. That's the idea of cross-dressing. We'll talk a little about it, but the point is that the Gemara broadens this idea much beyond garments and talks about to beautify oneself with the enhancements with which a woman beautifies her appearance. This is prohibited for a man. And there's some discussion. We'll get into a little bit of it. So cosmetics and the like, these are all included in the lo saseh of lo yulbash gever simlas isha. So the Meiri, interestingly, this is a funny thing. Today, it's hard to even imagine that he writes that you should wash your face, hands, and feet every day, and you need not be concerned that you're in violation of Simlas Isha, that you're beautifying yourself. Like women are concerned with their appearance and they wash, but maybe men should refrain, I guess, from that, because it's a feminine thing. So he said, no, it's not so. That Meiri actually writes that. So he said actually it's not the case, and he says it's for men and particular. He says particular scholars. He says actually she'ein there, the idea behind being appropriately bathed and concerned for one's hygiene and appearance. He says that's to look dignified in front of people, so that they shouldn't look degraded or inappropriate in front of them. Because that's the desecration of God's name, particularly for some of the Chachamim, or any person, a Jewish person, represent Hashem in this world, and the person should look dignified. So there's actually, and we'll talk a little about it, there's the idea that the way that kind of the stage of the paradigm that we have it set up is that women are concerned for their appearance, for their attractive appearance. Men are at least concerned for the dignity of their appearance and the dignified and appropriate look. Not quite the same, and we'll see a little about that. Some of the issues that come up in the context of cosmetic surgery. I just wanted to mention one last source before going on to our topic. From yesterday's parasha, it just occurred to me. We read it yesterday in Parashas Re'eh. So Parashas Re'eh, the pasuk says, "Bonim atem l'Hashem Elokechem," your, so to speak, children, metaphorically, of Hashem. So it says, "Lo sisgodedu v'lo sasimu korcha bein ein Hashem l'meis." So you shouldn't. They used to have among the ways of mourning for the deceased, they would make lacerations in the skin, cuts, lacerations in the skin. Lo sisgodedu, a Jewish person shouldn't do that. And they used to rip out the skin, rip out the hair, make bald spots in their hair out of their grief over the deceased. So it says, "Lo sasimu korcha lo meis." You don't rip out the head to make bald spots. Ki am kadosh atal Hashem Elokecha, because you're a holy nation unto Hashem. So there's the Rabbi Yosef Choshor, one of the medieval commentaries. He says that one of the ideas in this pasuk that you shouldn't do these things to your appearance, to make these cuts or lacerations, to rip out the head, to make the bald spots, because you are a am kadosh, you're a holy nation. So he says, because you're holy and consecrated to Hashem, you're not allowed to do degrading things to your appearance. That's inappropriate and wrong for a holy nation that's consecrated unto Hashem. So that's very interesting. In last week's Pasha, that's actually one of the ideas that's incorporated in this Lo Saseh, is the idea of being concerned for the dignity of one's appearance, that one's appearance should always be properly appropriate. Okay, so those are obviously, so we have this idea in various Torah sources, the Torah concept. We speak of the idea that a person should look appropriate, and Chazal in many places, and of course you have in Tanakh also many places speak, particularly in women, that they're concerned for the attractiveness of their appearance, that they beautify themselves. So this is a real Torah value, and as such, we raised a question with tonight's discussion about cosmetic surgery, which is surgery to enhance one's appearance. Under what conditions it might be a problem, what conditions it is okay. Like always, it's not really, I always say it's not really my job as a lecturer to issue. Well, we actually have a Rov here, so if you have any questions, you just go to him. He's going to respond to your questions in practice. But I don't want to give over the concepts, the opinions, the various analyses that you find in contemporary poskim, and talk about how they address some of the cases. So let me go through a few cases that come up. We won't go through them all. One of them is a facelift or a nose job, and someone doesn't like the appearance of the face. Nowadays, they actually have face transplants, which is a more extreme thing, where it's been started just recently, where they actually have transplanted part of the face. So a person had, unfortunately, whatever reason, a grotesque appearance of the face, so they transplanted part of the face. But obviously, short of that, you have facelifts, you have nose jobs and the like to change the appearance of one's face. Interestingly, I didn't see anybody was wondering about. I didn't see any explicit, specific discussion about using Botox. It's not, it's not that different from various other scenarios that come up. But I didn't see any interest. For some reason, anybody specifically addressed that. It's part of the discussion, and you'll see the way that it comes up. Another question, which is somewhat different, what we'll talk about is a question of hair transplantation. They transplant hair from a person who is very much lacking in hair in some part of the scalp, so they transplant hair from the parts that have hair. Is there any issues with that? There's also a couple of scenarios with tattoos. So you have cosmetic tattoos, they have eyebrow tattoos. Cosmetic tattoos, a lot of times they inject pigment into the skin, particularly for women generally, around the eyes or in parts of the face where they want to have an attractive appearance. And I guess obviously they need to put on makeup every single day because you just have it injected into you. So that's one thing that they do, the skin pigmentation. They also have eyebrow tattoos for people who don't have eyebrows, and they tattoo them with that appearance in the skin. So are there any issues with that? Now, I just want to mention one other thing, and we could even have, I don't know, Rabbi Silver weigh in on what he thinks, but I saw one person raise an issue here, one last case, which strikes me that it's not part of it, doesn't belong in the list. I was a little startled that it should be treated as the questions. And that is the question. Maybe somebody can tell me how you pronounce it. LASIK surgery, is that how it's pronounced? LASIK. LASIK? It's LASIK surgery. So that's the surgery where they surgically change the shape of the eye, the retina. So the retina, the cornea. The cornea, so that a person, I guess at that point, you're home free. You don't need any glasses or corrective lenses anymore because now your cornea has the proper focus. Focuses the optic rays properly. Anyway, so is there any question with that? Now, the thing about this particular case is that it's not a cosmetic surgery. I mean, so it sounds like it's a little odd that it should belong on the list. The truth is, it strikes me, I mean, I've been wearing glasses, since I was a little kid. It strikes me that a person who's nearsighted or whatever it is, that's a real condition. Now, granted, you can live a normal life with glasses, but I think all of us who wear glasses can remember the moments when they lost their glasses and were left, going crazy, trying to, grope around. And so, I don't know, to me, I'm a little surprised that somebody considered this as a serious halachic question, this question of the LASIK surgery. I think that the Talmid Chacham who raised it as a question, was thinking in terms that it's not that necessary. But I don't know, that sounds to me like a judgment call, I mean, it really is very necessary. It's just that we wear corrective lenses, which usually takes care of it, except when you lose them. So I don't know. I did see somebody else that said that it's obviously permitted. That's what I would think offhand, but that's just my thought of the subject. Okay, those are some. Now let me go through some of the I guess really 4 halachic issues that have been raised in this context. Some of them are more relevant. Some are a little less relevant, like we'll see. So the most primary question that's discussed at length in contemporary poskim is the question of chovel ba'atzmo. It's the question of causing some quote-unquote wound within oneself. Now, the Gemara has a whole discussion about this in the Seth of Abakama. The question of, you're not allowed to wound somebody else. You can't punch somebody else out and cause a wound in them. That's a losa say in the Torah. You're not allowed to do that. What about to cause a wound in yourself? Is there any prohibition against wounding yourself. So we might have the whole discussion back and forth to opinion, and we paskin that you're not allowed to wound yourself, which raises the question, obviously, of what exactly is the definition of a wound, and that's part of today's discussion, as we'll see. But fundamentally speaking, there is an issue. There is some question, by the way, exactly precisely what the source for this is in the Torah. There's a lot of lack of clarity on that. Be that as it may, we do accept this idea, according to many opinions. Wounding oneself is a Torah level prohibition, wherever exactly the source is, and you're not allowed to wound yourself. So what exactly are the parameters of this issue to wound yourself? Generally speaking, when you do cosmetic surgery, there's always some element of a cut that's made it to the skin. Now, on the other hand, it's to enhance your appearance, so maybe it's no problem. We'll talk about that. But fundamentally, we would need to raise this question about the fact that you're causing a wound within yourself. Now, of course, any surgery is going to cut into your skin, but if the surgery is really necessary, and particularly if it's a real serious health issue or a life-threatening condition, nobody's going to suggest that it's not allowed. But in this case, it's the need is much less. But okay, you're just trying to enhance your appearance. So we do have numerous poskim that have raised the question about whether there's some problem with chovel ba'atzmo, and that's actually the biggest issue, as we'll see, that discuss various perspectives, like we'll talk about when they discuss the question of cosmetic surgery. Now, the first posek who discussed the issue of cosmetic surgery appears to have been the Avnei Nezer, the Sochachov Rabbi, very important posek right around the turn of the 19th to 20th century. He was a Hasidic Rebbe, but also a very prominent posek. And he was asked the question, apparently there was a child who had a deformity in the leg, and they wanted to do some sort of surgery, whatever they did exactly in the year 1900 or so, to break the leg and to refashion it so that it would be able to be to straighten out the leg. That was the question. So the Avnei Nezer said flat out that it's prohibited. He said because it's dangerous and you're not allowed to endanger yourself. But then there's some element of danger to one's life, and therefore he flat out prohibited. So that actually is an halachic issue that was raised in the subject of cosmetic type surgery already well over a century ago. As we'll see later, the contemporary posts can pretty much do away with this issue, and they say that you really can't compare the state of medicine today in the year 2024 what it was in the year 1900, or 100 century and a quarter ago, or whatever exactly, when obviously things are much more primitive than they are today. And it probably made a lot of sense that Avnei Nezer discussed this as a danger to one's life. So this is not, most poskim don't treat this as a big issue, but it's one of the issues, but in contemporary times, they don't generally make a big deal. And we'll talk a little bit about it. The other two issues are in the question of the cosmetic tattoos, the pigmentation on the face or the eyebrow tattoo, whatever exactly. So there, post can discuss a separate question about kesoves kaka, which is in the Torah to put a tattoo, engrave it into a tattoo, I guess, tattoo, whatever the word is that you use, into your body. You're not allowed to do that. And the question is what the parameters, obviously, of that losas are. How far does it go and what are the parameters? And is there some possibility that might prohibit even this type of, even pigmentation, which sounds very, very different from what we usually think of as the Torah prohibition of tattoo or the eyebrow tattoo. So that's a question. And the final question that comes up is specific to men. I touched on it before, and that's the question of, but for a male to get a cosmetic tattoo, we have the question of lo yilbash gever simlas isha, which, as I said before, literally means that a man is not allowed to put on the garment of a woman. That's a little bit, it's clear in the Talmud in various places and in the poskim. There's many sources for this idea that it goes well beyond garment. And any type of cosmetic or enhancement of one appearance in the manner in which women enhance their appearance would be incorporated stuff, possibly Torah level, rabbinic level. We'll get into a little bit the parameters of that, so that for a man in various cases to go through some sort of cosmetic surgical process, some poskim discuss the way perhaps certain things will be permitted for women to go through, but not for men, because perhaps for a man he shouldn't be going through this process. It's a type of care for their appearance that women would engage in, but that men would not. There's all kinds of very, very interesting shuvah, by the way. Rav Moshe Feinstein was asked by somebody, by Talmud Chacham, why shaving doesn't fall under the prohibition of, well, yilbash gever simlas isha. It sounds like a very bizarre question, but the reason that the person challenged Rav Moshe with this was that Rav Moshe was very busy explaining that in his opinion, well, yilbash is result-oriented. In other words, you don't look at the the act you're doing, but the final result in your appearance. I'm trying to arrive at a particular appearance, which women want to achieve that appearance. So the person said to her, Moshe, so according to you, it should be also to shave. Because women are clean, have a clean, clean shin look, and men is trying to arrive at that. So it should be a problem. I actually, I was very startled, but I found today one early posting, 19th century posting, that actually did suggest this, that there's a problem with men shaving because of Yilbash. But Moshe responds by saying, interestingly, that that's not a problem. Why? He said, because women are naturally have a clean chin, and it's not something that women seek to achieve by means of some process. That is some natural thing that's a feminine look. So that is not an avera of lo yilbas when a man, even though you're arriving at the same conclusion that women have, but the woman has it by itself. And the man is doing, so that's not lo yilbash. But broadly speaking, and that's something to recognize, that lo yilbash gevet sim lasisha is to beautify oneself in the manner in which a woman beautifies herself in a very broad way, sometimes Torah level, sometimes rabbinic, as we'll see. And that's another issue that has been raised regarding cosmetic surgery. Okay, let's see how, I think that we started at right around 8:20. So we'll try to do, 45 minutes and 5 minutes of comments, questions, whatever there is. Okay, let me go through three kind of fundamentally distinct analyses that were offered by 20th century poskim. It's hard to say whether the questioner asked the same question to all three. It may have been different scenarios, but the question was very similar. It seems that Moshe Feinstein and also Rabbi, the Halacha of Switzerland, that they both were asked the question about a young woman who wanted to get a nose job for the purpose of getting a shidduch. In other words, she had apparently a very unattractive nose, or maybe that was her self-perception, or it was the actual objective reality, whatever it was exactly. But she was very concerned that she would not be able to get a shidduch with the shape of her nose. So she wanted to get a nose job for the purpose of getting a shidduch. And she was really, really bothered. It was something which really was, it wasn't just, some people want to get nose jobs because they happen to think the nose should be small or whatever. It was a very big deal for this young woman. And she really felt that she would not be able to get a shidduch. As we'll see, this is something which the poskim do discuss. In other words, is there a particular level of need that would be necessary in order to permit this? So, let's go through three analyses here. Analysis number one of Breisch of Switzerland, a generation and a half ago or so. And so he offered the following analysis. And again, the primary question that all of them deal with is the question of chovel v'atzmo, causing a wound. Now, obviously, as we're saying, it's you're breaking the nose or whatever it is for the purpose of enhancing your appearance. But at the first step of it, you are going through this so-called wound. And so to his analysis that he goes through, he says that we find some sources in the way he understands them that speak of the idea of pain and suffering being a reason to permit certain types of prohibitions, certain types of rabbinic prohibitions, particularly if there's pain and suffering be permitted. And he demonstrates that the halacha recognizes the concept of emotional pain. That today, emotional pain is actually a very, very big thing. But if you look back through the centuries, you find much less discussion, about emotional pain. But the Chalkas Yaakov brings a very important source for the halacha recognizing the notion of emotional pain being a real thing, which is also discussed in other contemporary poskim. And I'll stop on it for a moment because this is actually an important source. So the Talmud discusses a question. It's interesting. Today it's hard to relate to this, but maybe it's a cultural thing. That the Talmud discusses the question of picking and removing certain scabs from one's skin. And the Talmud raises the possibility that it may be prohibited for a male because it's lo yilbash gevet sim lasisha. Again, you're not putting on a garment, but this is an enhancement which women are concerned about and men are not. Today, I think it's hard to connect with that. I think men would want to get the scab off too. But whatever it is, this was the thing that women were quite concerned about the appearance of these scabs, and men were generally not. So the Gemara discusses the idea that it would be prohibited for a man to scrape off the scab off of the skin because of the problem of beautifying oneself in a feminine manner. So the Gemara says that where there is an issue of pain, then it is permitted. Where there's a pain function factor, the Tosfos says what pain? So you can have physical pain. Maybe the scab is causing you some sort of a physical pain. But Tosfos says that it goes much beyond that. Tosfos says that this scab, maybe it's in a prominent visible part of your body, your face, or whatever it is. You walk on the street, you feel ashamed and embarrassed to be seen in public, and you don't want to be seen by people in this fashion. It causes you to shy away from the company of others. So there's an emotional pain factor. Tosfos says that is sufficient to permit removing the scab. The details of that we'll talk about a little later, why exactly it's permitted because of the pain. But the point that's relevant to us is that, broadly speaking, this is actually important. So according to Tosfos, this idea is actually found in the Gemara. The way Tosfos understands the Gemara recognizes this notion of emotional pain, being unable to be in the company of others and feeling that pain, that's in some ways the equivalent of a physical pain. So that certain activities would be permitted in the context of physical pain also be permitted because of this emotional pain. So that's a very, very important concept which we find here in this context. And the Chalachas Yaakov extrapolates from there. His discussion is primarily not about yilbash, males and female appearance. He's really talking about the idea of wounding oneself. But he said that since his view, there are sources that indicate that wounding oneself is permitted under certain more extreme duress type need circumstances. I really need to go through this wounding to wound myself. So he says that it's permitted in those cases. And he says that emotional pain and suffering, deep felt emotional need is equivalent to that. So this is an important idea that Rabbi brings out, the Chalachas Yaakov, and he says that that's how he would paskin this issue with this young woman that feels she can't get a shidduch. So in other words, you want to know if you're permitted to get a nose job. According to Rabbi, the question would be, how great is the need? You just don't like the shape of your nose, it's not going to be allowed. But if you have a real deep felt emotional need, and in this case, this young woman really was convinced that she could want to find the shidduch and etc. So he says that under those conditions, it would be permitted because of this concept of pain. Okay, so this is analysis number one. Analysis number two is that of Moshe Feinstein. Moshe Feinstein takes a much more fundamental approach to address this whole question. I think it's the approach that a lot of us would have said based on common sense. That's what Moshe said. Moshe says that he believes that most fundamentally, this is not really fall under the prohibition of wounding oneself if you're enhancing your appearance. Wounding oneself, Moshe says, is a negative act. It's an act of detrimental to the person. You're creating a wound. But if you're doing it to enhance your appearance, that not included in the prohibition altogether. So you need a source. I mean, you could be as great as Rabbi Feinstein, but you still need a source. So Moshe brings a source. He says his source that he would bring from the language of the Rambam. Maimonides, the Rambam, when he brings down the prohibition against wounding oneself, so the Rambam says, there's actually interestingly two texts of the Rambam. So we have alternative texts. One is he says you can't wound yourself derech bizayon, in a manner that's degrading. You can't create a wound to yourself in a way that's degrading. The other version of the text is derech nitzayon, in a manner that's kind of antagonistic. Is there a better word for nitzayon, a manner of, fighting? So whatever it is, but either way is very similar, Moshe says, and not meaningful differences. And the bottom line, Moshe says, is that what we see from the Rambam is that the issue to wound oneself is when it leaves a negative impact. But when it's for the purpose of a positive impact, so then Moshe says it's not a problem. And Moshe actually he goes through some Talmudic passages to bring out this point, where we find in different contexts that in the Talmud, we find some places where they quote unquote wounded themselves because they thought this was a positive thing. One classic example, which is a whole topic in itself, is the subject of bloodletting, which was very, very commonly practiced, of course, not just in Talmudic times, but actually until recently. They had bankus. It was a big thing back in Europe. All the good Jews, they put the bankus on, and it was like suction, and it suctioned the blood out. So bloodletting was a big deal. And Moshe notes that perfectly healthy people would engage in the bloodletting. It wasn't like, if you were sick, there was also, there was all kinds of ailments that was assumed that bloodletting would be effective for them. But in addition to that, you had, there was a regular doctor checkup, your physical or something, you would have the bloodletting. So, and it's clear in the Gemara that this was part of, being health conscious life. And so Moshe says, the person they're healthy, and yet because this was considered part of a productive lifestyle, so they permitted what was a real wound, actual putting a wound and draining out some blood. And so this is one of a number of examples that Moshe gives that creating a so-called wound, or if it's a productive or positive purpose, in Moshe's opinion, is not a problem. Now that's what Moshe says. Moshe says this young woman is more concerned for the shidduch, and she feels she has to do the cosmetic surgery on the nose, and it's not a problem. This is certainly an important need to get a shidduch, and it's a very big reason to consider it a productive activity. Now, a lot of contemporary Chacham have noted something here that's not clear, and it's somewhat unclear. We'll talk a little about it. They point out that it should at least theoretically emerge for a Moshe that even some, let's say a woman, it's more usually women, she doesn't like the shape of her nose and she wants to get a nose job. You don't have the extreme duress of not finding a shidduch. Doesn't like her nose, what happens? You have some extra change to shell out and you want to get your nose changed, a shape better or smaller. That people do that. So according to Moshe, you could at least make the possible case that maybe it's permitted, because Moshe doesn't seem to start from the same starting point as Rabbi, who says, he talks about the pain and suffering and the emotional pain and suffering. And Moshe just speaks about the productive or positive nature of the act. So this is a somewhat unresolved question. We'll talk later about there's something of a consensus of the poskim. We'll see a little about it, but it's not entirely clear. It's really unknown. It's widely considered to be somewhat unknown how far Moshe would have gone in terms of the need, how much the need has to be. The case that was asked of him, there was a very real need, because it was a woman who was convinced that she wouldn't get a shidduch if she wouldn't undergo this cosmetic surgery. But Moshe doesn't make it clear ultimately how much of a need you would have to have. So we'll talk a little about that. The final analysis we'll go through is that of Waldenberg, a prominent posek in Israel, 20th century, the Tzitz Eliezer, who was the posek for the Shari Tzedek Hospital, a prominent posek. That Tzitz Eliezer was known sometimes for taking very original stances, and he didn't care, if you didn't like it. He had his own mind. So he writes that cosmetic surgery is absolutely prohibited under all conditions to get it. There's nothing to discuss. He says it doesn't matter if you feel pain or you feel emotional or you feel this. It makes no difference. Why? So he says that he said like this, that this is actually something which we could discuss somewhat separately, but let's touch on it briefly. There's a very, very interesting Gemara in Masechet Bava Kama, where the Gemara brings a pasuk in Parashat Mishpatim, V'rapo yirapeh. So that's the heal, he shall heal. So it talks about somebody who punched out his friend, and the send him to the doctor, and the doctor heals him. V'rapo yirapeh. So the Gemara focuses on the double language. V'rapo yirapeh. Heal, he shall heal. The Gemara says, Mikan sheniten rishus lirofei lirapos. That from here we find that it's permitted for a doctor to heal. So the Gemara says, and this is there's been a lot of discussion about this Gemara, but it seems for the Gemara that if not for a special pasuk, I would have thought that a doctor is not allowed to heal. That you have to just leave everything the way it is, and you're not allowed to heal. So the pasuk says, no, guess what? Virapo yirapeh. That there is a special permission, not just permission, but some added the mitzvah also. Okay, it's a mitzvah and a permission to engage in healing. Fine. But I would have thought, apparently, that you're not allowed to heal. Now, what on earth is that all about? And there's a lot of discussion. We'll leave most of it out right now. It's not for now. What on earth is this idea that I would have had that it's not permissible for a doctor to engage in healing? So Tosfos says, and I'm just cutting to the chase, we'll leave all the details out, that the bottom line is that Tosfos says over there on the page that I would have thought that this is a decree of God, and it's not our business to tamper with God's decree. Okay, so this leads into it's part of a very broad discussion, the whole notion of improving on God's world. I've spoken about it other times. Let's leave all that out. But that's the bottom line. The Tosfos says, I would have thought God did it, God said so, don't touch it. Don't tamper with it. So we say no. That God did do it. God created the ailment, He created the problem, the illness, but Hashem still wants that you, the physician, should engage and make things better and improve. Okay, so the Tzitz Eliezer says, and he quotes a somewhat earlier source, that suggests that there may be limitations on the heter. In other words, maybe there are instances in which we're left with the original idea that it's impermissible. God said so, God put it in place, that's it, we're done. So the Tzitz Eliezer says, and he actually quotes an earlier Achron that came up with this idea, that it's one thing if you have a true medical need. Okay, so the Torah says the doctor should intervene and get involved. It's not a true medical need, it's just a cosmetic need. You can live your life perfectly well. Okay, you may not like it, maybe you'll be embarrassed, whatever it is, but it's not an actual illness or a medical need. So there, we stick with the original idea, and we do not have the special pasuk. This is the Tzitz Eliezer's idea or his assumption. He says that if God made it so, it's not your business to tamper with God's creation. Then he quotes a bit of a story from the Talmud that he thinks supports this somewhat. Now, this is actually a rather startling idea. Even on the conceptual level, if they're at a stopping, they have the whole notion that in certain cases we have to leave. God said it's negative, but God put it in place and we just leave it. We're not really in the habit of thinking altogether of interacting with God's world in this fashion. Usually, and I've spoken about this a number of other times, it's actually Midrashic source of the bat. It's the whole notion that God put the world into place as a kind of raw material, and we should be improving on it. So, but this is Tzitz Eliezer's view, and because of it, he flat out prohibits all forms of cosmetic surgery, no matter how degraded you feel or emotionally you feel the need is. It doesn't make a difference to him. This opinion, Tzitz Eliezer, have been. It really is not accepted. That's the truth. We don't really find that people follow this view. It seems to be really outside the mainstream. And the concept that he articulates is outside the mainstream. Also, Rabbi Yosef actually has a critique of this analysis in which he says that it really seems to be outside of where we usually approach altogether, the whole halachas of medicine. That doesn't seem to be the way to go on this. Now, just as in other words, the bottom line is like this. In other words, that we do accept the notion that cosmetic surgery is something which is fundamentally permitted at some level. Also, some poskim anyway feel that there's a potential problem of wounding oneself, but nonetheless, under certain conditions, it's permitted. So therefore, the question then becomes, how much of a need do you have to have? Do we have to have someone who's really embarrassed? They can't show their face in public. They feel they look so grotesque, or the girl who feels that it's going to be impossible for her to get married. How far does it have to be? Or just, you have a really unattractive appearance and et cetera, et cetera. So there seems to be different views on this. It looks like, and this is what Rabbi writes in an article that he wrote on it, it looks like the more accepted view, or the somewhat consensus view appears to be that the contemporary poskim do not accept the idea of getting a nose job just on a whim, just because you don't like your nose and you want it to be changed. So we do give weight to the poskim who feel that there has to be some deep felt emotional need. Exactly how much of this, how great is the emotional need has to be, does seem to be somewhat subjective in different poskim. The Chalkas Yaakov of Reich seems to have felt that it has to be a real driving emotional pain, like he gives the example of the woman who feels that she'll never be able to get married, heaven forbid. So that's what he said. Rabbi Yosef actually approvingly quotes the Chalkas Yaakov, quotes this analysis, but he goes on to say that in his view, even a woman is already married, but she feels that her appearance is making her somewhat unattractive for her husband. So he says, Rabbi Yosef said, "Shalom bias." That's also, so that we'll be able to have better harmony in the home if her unattractive appearance could be rectified. So you can see that could lead to a certain amount of subjectivity there. How far would you go with that? And you have to consult with your Rav on it. But it does seem that as a general matter, the poskim today do seem to accept the notion that fundamentally speaking, cosmetic surgery is permitted where there is a need, and there needs to be some sort of a tsar, some sort of an emotional distress because of one's appearance, and whatever level there is that's needed for that, the poskim accept that you could permit it under those conditions. I don't want to run out of time, so let's go through a couple of the other questions. Now, regarding quote-unquote cosmetic tattoos or eyebrow tattoos or the like, like we said before, again, they have a process today in which they would inject a type of pigmentation under the skin or under the outer layer of skin of the woman, right in the area of the eyes or other places. So it's sort of in the manner of a makeup, but you don't have to apply it every day, and it stays there in a semi-permanent manner for some length of time in this fashion. And the poskim could discuss whether this is prohibited based on the idea of tattooing. Now, just very quickly, we're not going to get into all the details of tattoos, but although it might sound surprising, this issue is taken very, very seriously by the poskim. The problem, although a number of poskim suggest there might only be a rabbinic prohibition of tattooing and not a Torah level prohibition of tattooing, I'll just go through some of the issues that are raised and why it's important to understand why it may or may not be rabbinic prohibition or Torah level prohibition. So basically, there are a couple of issues. One of them is a question of how long a tattoo has to be, how permanent it has to be for it to be a Torah level prohibition. Now, it seems that there are clear Talmudic sources that even a quote unquote semi. Now, here we have, for example, let's go to the other extreme. We have you go to the park and your kid gets stamped with a stamp on their hand. Now, this would be a permanent stamp on your hand. It doesn't last forever, obviously, because the the skin rubs off. But if it would be intended to be a permanent, there could actually be a rabbinic, or not a total level prohibition. Total level prohibition is only where tattoo actually makes the holes in the skin and the pigment goes under the surface. But there could be a rabbinic problem. However, this is just, it's a day in and day out. It washes off or something, and that's not considered to be a problem under those conditions. However, if a tattoo is, or in this case, we're talking about an actual tattoo, it goes under the skin, and it's at least semi-permanent, then there could be at least a rabbinic level prohibition. Also, the poskim are not certain exactly the definition about semi-permanent, what is called semi-permanent, what's called permanent. There's all kinds of theories exactly how long a tattoo has to be able to last for it to be called permanent and be a total level prohibition, how long it's to be semi-permanent to be a rabbinic level prohibition. But there is some level of prohibition if the tattoo is meant to last a long term. Another question that comes up, which is also a big discussion back and forth, is a question of whether a tattoo is specifically words or numbers or letters, or it could be anything else. So a tattoo, or maybe it could be a picture. Many poskim do hold that a picture. I think people have all kinds of things. People have the craziest things tattooed onto them. All kinds of images that get tattooed onto their skin. And many poskim do hold that is also a Torah level prohibition if it is a picture tattooed onto the skin, even if it isn't words, letters, or numbers alike. However, Rabbi Nebenzal, who should live a long, healthy life, the chief rabbi of the old city, so Rabbi Nebenzal, a prominent posek, has raised a question about, he says, fine, if it's a picture or if it's a word, that's a tattoo. But what about if this just gives an appearance to the skin? It's not this pigmentation that you're tattooing under the skin, like a makeup or the like. That doesn't have any kind of an image to it. It doesn't have, not just not lettering, but it's not even an image. So in his opinion, he said that's so dissimilar from a classic tattoo that he thinks it's not a problem at all. That's his view. That this to sort of a pigmentation type tattoo is not a problem. Now, most places can reject it. There's people who have gone around and asked the question to numerous contemporary poskim of the last generation, of Yashiv and Shlomo Zalman and many others of Rabbi Yosef. Many poskim were questioned about this, and they all felt that at least it's a rabbinic level prohibition. Might not be Torah level, but is rabbinic, and there are actually Talmudic sources that do seem to indicate this way, that even if it doesn't have a clear-cut depiction, nonetheless, if you change the appearance of the skin by injecting something, then it would be a problem at least on the rabbinic level. So most poskim do hold, fundamentally speaking, that there is a problem in getting this type of cosmetic tattoo, the pigmentation. However, there's the late, he passed away, I believe, the late Rav Schnebel from London. You would know, the older one. He passed away a number of years ago, no? No, he was Manchester. Yes, he was Manchester. The Shraga Meir. Yeah. See, so he was this like a year ago. Yeah. No, I kind of know the Rav. His son in Muncie took over. And so he was lifted by the Rav Schnebel from Manchester. Passed away about a year ago at the age of 100. He was quite an elderly man. He was a prominent halachist. He wrote quite prolifically on halacha. So he has a whole discussion about a woman. He discussed a woman who was born without eyebrows, doesn't have any eyebrows, and this takes away. It really bothers her a great deal. It takes away from her appearance. Or there's another scenario that could come up. So the question is about tattooing eyebrows onto that individual. Another question comes up with regarding scars. So you have a scar, and apparently you can inject pigmentation, and that would take away the discoloration and the negative appearance from the scar. So that's another question. It's also a question of kind of emotional pain. Both of these are questions of emotional suffering that a person would go through. And the question is whether one could permit injecting this sort of a cosmetic tattoo to address that. And he feels that it is permitted. And I spent some time looking at the tshuva, understanding why it would permit it. Basically, the bottom line that results from his analysis like this, that he says that we find in a number of halachic contexts, a little tricky to know when, but in a number of halachic contexts, we find that we permit rabbinic prohibitions in cases of significant pain. And also, as we just spoke earlier today, significant emotional pain. So this is a notion in halacha. You have to know when and how to apply it. That when we have rabbinic prohibitions, in certain contexts, we would permit them in the context of great pain or significant emotional pain. So he says that in order to know whether this types of cosmetic tattoos where you have significant emotional pain, you need to know, to determine whether it's mutter, you need to know whether it's total level prohibited, in which case we can't permit it, or whether it is rabbinic level prohibited, in which case we could permit it. And his argument is that there's several possible arguments to be made why it might be only rabbinic level, so you could combine them and that's good enough. For example, it could be that since it's only pigmentation and doesn't have an appearance of numbers or letters or the like, maybe that's one reason why it might be only rabbinic. Another possibility, he says, is that it maybe it's, I don't know exactly how long it lasts, but however long it lasts, it's not truly permanent, this pigmentation, and maybe that's only called temporary and not permanent. That would be another possible argument to make why it would be only rabbinic and not Torah level. So he combines a few possible arguments why it might be rabbinic level prohibition, not Torah level, and with the various arguments together, he feels that you could be comfortable in treating this scenario for our purposes as a rabbinic prohibition of a tattoo, and therefore, in the case of emotional pain or suffering with the eyebrows or the context of the scar, so he says he feels that would be, you could permit that. To make the cosmetic tattoo in that case. Let me go to the last scenario, and then we could open the floor. It took us a couple of minutes. I wanted to talk a little about hair transplantation. What makes this case distinct from the previous cases is that if it's done for men, it raises several issues. Specifically about the men. So just to go through this, we'll talk a little about it. Hair transplantation is a thing where person has a very significant, maybe disfigurement, certain parts of the scalp have no hair. So they take the hair from parts of the scalp that have more hair and transplant it onto the part of the scalp that has less hair. Now, some have suggested that in general, altogether, broadly speaking, as I mentioned earlier, this might be an example among certain other cases of a scenario in which this is something which women are much more concerned about than men, and that women would engage in this type of activity for the purpose of enhancing their appearance, whereas men very often ignore the whole issue of being bald or the like, and women are much more concerned about it. So there might be a problem of Yilbash Gever. But additionally, interestingly, there's another thing that apparently when they do this, they have to shave off all the hair. Apparently they do that before they transplant, they shave off all the existing hair, and sometimes they feel they need to shave off all of the Ha'asarosh, the sideburn hair as well, which that's a very serious issue. Of shaving off the Peos HaRosh. So that would be apparently, I guess you can do it apparently without shaving off the Peos HaRosh, but that's something to be vigilant about. But another thing is the question of tefillin, because apparently when you get the hair transplant, so for several days, you can't put anything weighing it down. It would mess up the transplant will take. So you won't be able to wear tefillin for several days. And another question that's been raised, at least as a conjecture, is that maybe since the transplanted hair is some foreign entity that was stuck and transplanted onto this part of your head, so maybe it's a obstruction, a chatzitza for the tefillin. It's like something is stuck between your head and your tefillin. You can't have an obstruction. This might be an obstruction because it's some hair from some other part of your body that was placed there. So this one is not considered a problem. This one we can dismiss. Rabbi David Yosef in the Sefer Halacha Brura, important rabbi in Israel, Rabbi Yosef's son. So he said that that's not an obstruction. That becomes part of your body, and which is a fundamental idea. You transplant, it grows, it's part of your body, and it's not an obstruction. Okay, we can deal with that one. What about the other issues? So basically, as far as the tefillin issue, I saw one thing, and I just want to answer something on my own. One person wrote that actually he knew of a case in which they did the surgery on Erev Pesach. So that way it went through a Pesach Chol Hamoed. Anyhow, many people don't wear tefillin, and Yontif, you don't wear tefillin. But if you can do that, that solves the problem. And something else I just want to throw out. I'm just wondering if something else, if you can't do it that way. There is actually a big question that was raised by a couple of the later 20th century Rabbanim. That is a question of whether you could, there's something of makeup time on your tefillin. In other words, if you missed wearing tefillin on a particular day, can you make it up the next day? Actually, Rav Shach, when he moved to Israel, when he was living in Lithuania, so his minig was he put on tefillin Chol Hamoed every day. He moved to Israel, and over there he joined the community where the minig was to not put on tefillin. So he was nervous about that. You follow him in the community, but he wanted to make it up. So he had this idea that you could make it up after Pesach. And he would wear tefillin for several days at the Pesach, twice as long. So that was his. Now that's an interesting question. So not for now, but maybe you could conjecture that someone who needs to get the hair transplant, maybe there's this concept of a makeup day, and you'll make it up afterwards. Anyway, so basically what it looks like. And let me just say this, and just we'll conclude and summarize just briefly. As I said before, I don't always listen to Rabbi Miller. I mean, Rabbi Miller's a good man. Should always listen to Rabbi Miller. But unfortunately, I haven't been listening to him about making his speeches. So we'll just conclude as we conclude. But it looks like the bottom line is that Rabbanim accept with regard to the hair transplant, this particular maybe more than other cases, that it really depends on having a true need, a real emotional need. Some people, for example, there have been instances of a young man who feels he can't find a shidduch, right? He looks totally very bald and the girls don't want to go out with him. He's a young man, he's already bald like that. So in cases like that, it's been suggested that we would actually be able to permit it. Then obviously you do have to work around the problems with the cutting off the payas, the shaving off the payas, which you don't want to do, and the other issues as well. However, if it's not a true pressing need, so the poskim do say for men particularly that it's something which there's something where there's more of a concern for a Yilbach, particularly wouldn't do it. As I said before, though, and let me just summarize with this and conclude with this, the truth is it looks like pretty much the consensus of the poskim within a certain amount of subjectivity is that cosmetic surgery, broadly speaking, is considered permitted depending subjectively on the amount of the suffering, the amount of the pain, the amount of emotional need, and exactly how much you need is obviously very difficult to measure, and there seems to be possibly different views on it anyway. So one could argue that maybe men, there has to be a more clear-cut emotional pain in those instances in which you're enhancing your appearance in a manner that women generally enhance their appearance, and maybe for the man, it's something which is, it's something which might be called enhancing oneself in the manner of a woman, etc. But that seems to be pretty much the bottom line in most of these cases. And as I mentioned before, in the context of the tattooing, it raises other issues as well. But there also, Rav Schneeberg was of the opinion that if there is a true, real emotional need, then he felt that you could permit the cosmetic tattoo as well. Okay, let's take a couple of questions, comments, whatever they are. Yes.
Yeah, so there are a couple of things. One is I just want to clear up. There's a difference between bakas and bloodletting.
Okay.
Bakas are not bloodletting.
Okay.
Bakas are cups that you fill with alcohol, light them, so they create negative pressure. You put them while they're hot on the back, and it's supposedly because of the negative pressure, it lifts the skin, and it's a very tight seal. And it's supposedly, the reason this was done was a 17th to 19th century idea that you got sick because of bad humors. And this was a way of sucking out the humors through the skin. There is a way of bloodletting similar to that, using actually live leeches.
Leeches, sure.
Okay, which can be in very many circumstances life-saving. And it's not stem bloodletting. So you put it in particular limbs or areas that have huge amounts of blood and that have to be gotten rid of. You can't get rid of it in a normal way. This saves a limb.
All right.
So that's why you use leeches. Okay. With regards to tattoos, there are tattoos that are permanent, which are needed, for example, for radiation therapy. So when radiation oncologists plan out the area that is going to be subjected to radiation for cancer, they're very careful because they don't want to get outside of that area because they don't want to damage good tissue. So they pre-measure the area where it is, where they have to go, and so they don't make a mistake. They actually put ink into the skin. They'll triangulate to do that. So I'm just laying it out there.
I mean, look, fundamentally speaking, it's obviously Sochanos Mefashot in that case. I guess theoretically you can make the argument that if it could be impermanent, then do it in an impermanent fashion.
But the answer is I don't know. It's because I'm not a radiation oncologist, but everything that I've seen is they use permanent ink.
Okay,
but I guess they could use non-permanent ink. I don't know what non-permanent ink is.
What's that?
Started using photo photography for that.
Really?
They mark it with a washable marker, and then they take pictures of it. They project the pictures when they do the surgery. All right.
I have not seen that.
So if you have a choice,
and I
do it that
take
way.
care of kids all the time in radiation oncology.
All right.
We have to.
I have a question. So far, the discussion was all about the perspective on the patient. What about the perspective on the surgeon?
All right. It's just I was just wondering about it. But I was only because someone brought it up actually.
Could you repeat it louder?
What about the perspective of the surgeon? The person is the one who's doing the surgery. He is being chayvel.
Well, that's for everything.
Yeah,
Can I just say, I don't know clearly the answer, but I just throw out a thought on this, just something I was thinking about. I'm wondering within that question whether the distinction between a Chovel and a Jewish patient or a non-Jewish patient. I don't what I said politically incorrect, but
so I was going to bring up a couple of things. One of them is that there is discussion. There's discussion about doing a circumcision on a non-Jew, whether it's a question of Chovel, because like you wouldn't be allowed to do it on Shabbos. Everybody knows that. And whether or not there's an issue there.
well, I mean, obviously we do it. I mean,
Right.
yeah.
So why is that an issue? So the question is really,
There's no mitzvah and it's cosmetic.
but it's not just cosmetic.
Okay.
So there's evidence that males who are circumcised have a much lower incidence of penile cancer than those who are not circumcised. So you could make the argument that this is a preemptive strike, and therefore it is to the ultimate good. Obviously, every surgical procedure has a risk associated with it, but the reason to do it is not simply cosmetic. And there may be, I don't know, but there may be subpopulations that have a higher incidence of penile cancer than others, not necessarily Jewish, for whatever reason. I don't know what that might be.
Just saying that.
But
Yeah, but I mean, it's hardly clear that this penile cancer thing, which is no reason to think this person will ever have, that necessarily is going to. I mean, there's no specific reason to think that this particular individual will ever come down with penile cancer. It's I'm not. You have to think through whether that's sufficient. If it will be a problem, right?
that may not be the initial purpose, but it's certainly.
Yeah. Okay.
And it's statistically, it's an end result.
Right.
The decrease to UTIs as well. I mean, it is a society recommendation.
Oh, it is really?
For the
Okay.
I'm sorry.
The other
was at least as of like
the other source that I was thinking of was on, it's in Hilchos Shabbos, it's mentioned, but it's relevant all the time, that they straighten, when a baby is born, they straighten the limbs so that the baby shouldn't be mildly deformed. And the question is how that's done on Shabbos because of the.
Right. That's why. Let me mention something over here. There's a very, very odd question that's raised by Rabbi Ovadia Safe. It sounds very strange, but then you wonder exactly the answer. He says, "What exactly is the headless woman to get the ears pierced if you really believe that every single time you cause a wound, you have to start asking whether it's properly justified?" So nobody's going to suggest that women are not allowed to get the ears pierced. What's that? What's in the Torah? Okay, so but here now that is correct. Rivka seems to have had her nose pierced actually, but is it a special Xeris HaKosra? I mean, am I assuming that it would have been not permitted except for this special pasuk? No, so it's obviously mutter, So the reason I'm bringing it up is that this raises the possibility that anything which is considered to be just normative behavior is, in the Gemara's time, this was also normal behavior to straighten the limbs of the baby.
One other thing is that we talk about removing extra fingers.
Extra fingers?
Extra fingers.
Yeah. So the question is, there bone in there or not?
Right. That's in the Gemara.
Okay. So and they're almost. I've learned in medicine never to say never, but they're almost always non-functional, and they're almost always a detriment to the child's development.
So that works.
That's not cosmetic.
Right.
Well, so I don't know. You talk to the people who do this and follow this over a long time. What about supernumerary nipples? What about difficult? There are ear malformations.
Raj would say,
I mean, the whole thing of,
like you have less limbs.
what about congenital kids with congenital malformations of their cranium that make them look to the general public grotesque?
Right.
So
I think there's also a health issue there.
What?
There's usually some sort of health issue there also. We just had someone make
well, you have to decide what the health issue is. If a child looks grotesque to the rest of the world, and he has developmental abnormality, then whether he's going to be able to live with it or not, it really depends on his surroundings. The answer is 99.99999% of the time, he's going to have a miserable life. Miserable life. So, because they're going to be making fun of him, and the likelihood that the child is going to grow up psychologically normal is extremely low. So, let me
just take the question. I say yes.
So I think the elephant in the room with regard to cosmetic surgery is Botox and filler, right? So 15 times, if you take all your facelifts and everything else, 15 times the number of people get Botox and filler, right? So Chovel, is this Rika, an issue of an injection? Is that the idea of making creating a hole and a wound? That's, I mean, also.
Can you tell me something? I want to hear something about this. When you inject the Botox, is there bleeding? Is there
minor?
Maybe this is wrong, but I've been wondering that if the same way a woman can get her ears pierced, maybe this is such a minor activity that it doesn't count as Chovel at all. So then you could be on the right.
Well, we do it with the neck. We put his ear up against the doorpost and put it all through it. So that he
I look into this stuff.
So
it's
20 million people
in the U.S. So 1 out of 10, 12. So I mean, it's pretty normative.
What?
Get Botox or filler.
No, I hear you. I don't know.
1 out of 10 or 12 people get Botox or filler.
Today?
Yeah.
Crazy people. No,
it's probably more than that.
I know. So, it's a good. I didn't see anybody discuss this, but I hear the argument. Though I can hear an argument in it, but it's maybe we should find out more about it. We never see
At what point does it become normal?
Okay. Yeah.
How many people are there being
normal?
Could you rely as a practitioner, as the provider? Could you rely on Rabbi Feinstein's Shuba about being the Chabad or being
that may be. Part of the problem is that nobody knows 100% how far Moshe was going to go with this. Like to do a want and nose job or something. But maybe as a practitioner, you could be more possible to. I don't have to find out more about this, about the question of the practitioner.
Isn't Chovel just have the same restrictions as Chovel Batmi?
What you mean? You're thinking fundamentally speaking, I think it's a problem. That's what you're saying.
I'm saying that if Chovel Batmi is allowed, then Chovel.
Mishpat Shiloh.
Yeah.
Mishpat Shiloh.
Yeah.
Yeah.
And with regard to alopecia, is an autoimmune disease of the skin. It can be generally in the scalp, but it could be anywhere on the body or all over the body, and you lose your hair. So are you allowed to do a hair transplant? You were intimating that it's distressing to women, but not to men. I'm just telling you, in my career, I cannot tell you how many men came to me with this particular problem. Extremely distressing. Almost nobody, by the way, was unmarried at the time. I don't know whether that's because the stress of their marriage was to get alopecia, but I will tell you that it is extremely distressing.
All right.
Okay. What did they do about it? Different people did different things. If it's in small areas, they'll often try and get a hair transplant. If it's all over their body, they wear toupees, shadeless, and things like that. But to be, completely bald, hairless, I'm not talking shaving, is very distressing.
I imagine. Okay, thank you very much. I don't want to keep everybody. Thank you. We'll have to look more about the
Sorry, question.
Oh, yes.
What happens like if you have a snake change like that, you have a knife, you need to.
Well, that's definitely permitted.
That's
That's sort of medical needs footage. Okay, thanks. You. Hey.
That I haven't heard of. I know it's extremely distressing to women. So I know that but to say that it's not distressing.
Give me a second. Hold on a second. But I'll put it back.
It's a bit of it's a stretch.
Oh, thank you so much.